Welcome to Health 2660. Here we don't just talk about health, we tell the stories that heal. Now please listen to the story. The news hit me like a rogue wave. At 58, I considered myself relatively healthy. Sure, I enjoyed my share of weekend barbecues and late-night snacks, but I also walked regularly and tried to incorporate salads into my diet. So, when Dr. Albright, my family physician of 15 years, delivered the verdict, "Your cholesterol is too high. We need to put you on a statin," I was taken aback. I trusted Dr. Albright implicitly. He had seen me through countless colds, a bout of shingles, and even convinced me to finally get that colonoscopy I had been dreading. So when he prescribed atorvastatin, I didn't question it. I filled the prescription, religiously swallowed the little white pill every evening, and dutifully returned for follow-up blood work every 3 months. Initially, the numbers looked promising. My total cholesterol plummeted, and my LDL cholesterol, the so-called bad cholesterol, was well within the target range. Dr. Albright praised my adherence to the medication and cheerfully declared me a model patient. I should have felt elated, vindicated even, but I didn't. Instead, I felt off. A persistent nagging fatigue clung to me like a damp shroud. I woke up, tired, dragged myself through the day, and collapsed onto the couch in the evening utterly depleted. My brain felt foggy as if stuffed with cotton. I struggled to concentrate, forgot appointments, and even had trouble recalling simple words. And then there were the muscle aches, a dull, throbbing pain that radiated from my shoulders down to my calves. At first, I dismissed these symptoms as signs of aging. After all, I was approaching 60. Maybe this was just what getting older felt like. But deep down, I knew something wasn't right. I was following doctor's orders, diligently taking my medication, and yet I felt worse than ever. Confused and increasingly concerned, I decided to do some research. I started with a simple Google search: statin side effects. The results were alarming. Fatigue, brain fog, muscle weakness, all common complaints among statin users. But the more I read, the more I realized that the issue wasn't just the side effects of the drug itself, but something far more fundamental. I stumbled upon articles questioning the very premise of the cholesterol hypothesis, the long-held belief that high cholesterol is the primary driver of heart disease. I learned that cholesterol is not the villain it had been made out to be. In fact, it's essential for life. It's a crucial building block for cell membranes, hormones, and vitamin D. It's vital for brain function and nerve health. My mind reeled. How could something so essential be so demonized? I delved deeper, spending hours poring over scientific studies, reading books by independent researchers, and listening to podcasts featuring dissenting voices within the medical community. I discovered that the normal range for cholesterol had been redefined in 1987, the same year that statin drugs were introduced to the market. Suddenly, millions of people who had previously been considered healthy were now labeled as having high cholesterol and prescribed medication. The coincidence was too glaring to ignore. As I continued my investigation, I uncovered a web of financial ties between pharmaceutical companies, medical associations, and even the very committees that set cholesterol guidelines. It became increasingly clear that the narrative surrounding cholesterol had been heavily influenced by vested interests. My anger began to simmer. I had blindly trusted my doctor, who in turn had blindly followed the guidelines dictated by these compromised authorities. I had been turned into a patient not because I was truly sick, but because it was profitable. But the rabbit hole went even deeper. I learned that cholesterol isn't just one homogeneous substance. It's transported through the bloodstream in different types of particles, primarily LDL low-density lipoprotein and HDL high-density lipoprotein. LDL is often referred to as bad cholesterol because it carries cholesterol from the liver to the body's cells, while HDL is known as good cholesterol because it carries cholesterol back to the liver for removal. However, the story is far more nuanced than that. LDL particles come in different sizes and densities. Large buoyant LDL particles are relatively harmless, while small, dense, oxidized LDL particles are far more likely to become trapped in artery walls and contribute to the formation of plaque. Statins primarily lower the total LDL cholesterol number regardless of particle size. In other words, they might be lowering the large, harmless LDL, while having little impact on the small, dense, oxidized LDL that truly poses a threat. Furthermore, statins interfere with the body's production of CoQ10, an essential nutrient that plays a vital role in cellular energy production. This CoQ10 depletion could explain the fatigue and muscle weakness I was experiencing. Armed with this newfound knowledge, I decided to take matters into my own hands. I scheduled an appointment with a functional medicine doctor, someone who looked beyond the standard blood tests and sought to identify the root cause of my health issues. Dr. Ramirez listened patiently as I recounted my experience with statins and my growing concerns about the conventional cholesterol narrative. She agreed that my symptoms were likely related to the medication and ordered a comprehensive panel of tests, including a fasting insulin level, a triglyceride, a HDL ratio, and a high-sensitivity C-reactive protein (HSCRP) test to measure inflammation. The results were eye-opening. My fasting insulin was elevated, indicating insulin resistance. My triglyceride HDL ratio was high, another marker of metabolic dysfunction. And my HSCRP was through the roof, revealing a significant level of inflammation in my body. It turned out that my real problem wasn't high cholesterol at all. It was metabolic syndrome, a cluster of conditions including insulin resistance, high blood pressure, abdominal obesity, and abnormal cholesterol levels that significantly increases the risk of heart disease, diabetes, and other chronic illnesses. The statin was merely treating a symptom, while the underlying cause remained unaddressed. Dr. Ramirez explained that metabolic syndrome is primarily driven by diet and lifestyle factors. The standard American diet, high in processed foods, sugar, and unhealthy fats, wreaks havoc on our metabolism, leading to insulin resistance, inflammation, and oxidative stress. Oxidative stress, she explained, is an imbalance between the production of free radicals and the body's ability to neutralize them with antioxidants. Free radicals are unstable molecules that can damage cells and contribute to chronic disease. She prescribed a radical overhaul of my diet and lifestyle. First, she recommended eliminating all processed foods, refined sugar, and unhealthy fats, particularly seed oils like soybean oil, corn oil, and canola oil. These oils are high in omega-6 fatty acids, which can promote inflammation. Instead, she encouraged me to focus on eating real whole foods, plenty of vegetables, fruits, lean protein, and healthy fats like olive oil, avocado, and nuts. She also emphasized the importance of getting enough sleep, managing stress, and engaging in regular physical activity. Sleep, she explained, is crucial for regulating blood sugar levels and reducing inflammation. Stress, on the other hand, can trigger the release of cortisol, a hormone that can contribute to insulin resistance and weight gain. And exercise helps to improve insulin sensitivity, reduce inflammation, and boost overall cardiovascular health. It wasn't easy. Breaking free from my old eating habits was a challenge. I had to learn to cook from scratch, read food labels carefully, and resist the temptation of processed snacks. But gradually, I began to feel better. My energy levels soared, my brain fog lifted, my muscle aches subsided, and as I continued to make progress, my lab markers improved as well. My fasting insulin normalized, my triglyceride 8-HDL ratio decreased, and my HSCRP plummeted. After 6 months of diligent effort, I returned to Dr. Albright for a follow-up appointment. He was surprised to see me looking so vibrant and energetic. He reviewed my blood work and frowned. "Your cholesterol is up," he said, pointing to the numbers on the screen. "We need to increase your statin dose." I took a deep breath and calmly explained everything I had learned. I told him about metabolic syndrome, insulin resistance, inflammation, and the importance of LDL particle size. I shared my research on the financial ties between pharmaceutical companies and medical authorities. I showed him my improved lab markers and described the dramatic improvement in my energy levels and overall well-being. Dr. Albright listened patiently, but I could see skepticism in his eyes. He was a product of the conventional medical system, trained to follow established guidelines and prescribe medication as the first line of defense. He had a hard time accepting that a lifestyle change could be more effective than a pill. "I understand your concerns," he said finally, "but I still believe that statins are the best way to protect you from heart disease." I knew I wasn't going to change his mind. So I thanked him for his time and left his office. I never filled another statin prescription. I continued to follow my healthy lifestyle, and I continued to feel better every day. I had taken control of my health, not by blindly following doctor's orders, but by educating myself, questioning conventional wisdom, and listening to my own body. My journey had been a wake-up call. It had taught me the importance of critical thinking, independent research, and a healthy dose of skepticism when it comes to medical advice. It had also shown me the incredible power of lifestyle change to heal and transform the body. Before I end my story, I want to emphasize something important. My personal decision to stop statins was based on my own health context lab work and careful lifestyle adjustments. However, this doesn't mean statins are bad for everyone. In fact, for people with a history of heart attack, stroke, or severe artery disease, statins can be life-saving. Large-scale studies have shown clear benefits in reducing future cardiovascular events for high-risk patients. The key point is not to fear statins, but to ensure that any decision about starting or stopping them is made thoughtfully with the help of a healthcare provider who considers your entire health picture, not just a single cholesterol number. Medicine should never be one size fits all. It's about finding the best path for you based on risk lifestyle lab markers and how you feel day to day. Additionally, if you're currently on statins or considering them, never stop or change your medication without consulting a qualified healthcare provider. Your individual risk, family history, and other health markers must all be considered. What worked for me might not be right for you. This story is not about rejecting medicine, but about encouraging deeper understanding and balance. Statins, like any tool, can be powerful when used correctly. Talk openly with your doctor, ask questions, and explore all the markers that matter, including lifestyle factors like diet, movement, sleep, and stress. Health 2660 thanks you for listening. We'll see you in the next video, and until then, be kind to yourself.